Welcome to the Thames Valley Cancer Alliance Health and Wellbeing series. We aim to bring you expert advice from a range of professionals on a variety of topics that we hope will help people living with a cancer diagnosis. We also hope this is useful to anyone caring for or supporting someone living with cancer. Our speakers are from NHS trusts and wider care organisations based in Buckinghamshire, Berkshire, Oxfordshire and Swindon. Today I'm joined by Mark Folkes, lead cancer nurse for Royal Berks Hospital Trust. He's going to give us an overview of the COVID-19 pandemic, which includes the impacts of the pandemic on cancer care and treatments, as well as emerging evidence around immunity, vaccination, and those who may be more at risk from the virus. This is being recorded in September 2021. As COVID is a changing landscape, please bear this in mind. These sessions are for you, and we're keen that they cover the subjects you want to know about. So please leave us your feedback in the comments with your suggestions. If you find this session useful, please like it and subscribe to our channel so that we can bring you the latest on our health and wellbeing sessions. And I'll now hand over to you, Mark. Thank you.
Hello there, my name's Mark Folkes. I'm the Macmillan Lead Cancer Nurse and Nurse Consultant in Acute Oncology here at the Royal Berks in Reading. And I'm going to talk to you today about the COVID-19 pandemic and what it means for cancer care, what it means specifically for people who have a cancer diagnosis and have some treatment and those who care for them. So I hope you'll find it useful and I'll press on. So what I'm going to talk to you today about is about the effects of the pandemic on patient care, as it has been talking about sort of wave one really from the very start. Have a little think about what that meant at the time. Where we are now, which is slowly coming out of wave three, I hope and expect. I'm going to talk about longer term effects on patients with cancer diagnoses. I'm going to talk about a little bit about vaccines and cancer and some of the challenges that we face and that you face every day. And then I'm going to sort of summarise those a little bit. So I hope that makes sense. So if I look back in those heady days of February 2020, when all of this started, the sort of first wave of the COVID-19 pandemic had a very big effect, a profound effect on people with cancer, because we didn't really understand what the overall effects were going to be on our services. So we probably overreacted rightly to that because we didn't know what was going to happen. So our oncology units largely across the UK either moved off site from the acute trust or were moved to secure environments, or staff weren't allowed to be shared with those units. Clinical nurse specialist teams were disbanded and redeployed normally to look after patients in ITU or look after patients who had end-stage COVID on wards or help staff COVID wards. Another really serious side effect was that some patients having chemotherapy treatment either had this discontinued, had the treatments changed or paused. And there's lots of distress and worry about that, with difficult conversations with people. And that was because we didn't know at that point what the effect would be of being on chemotherapy and having a risk of COVID. We thought that that might be very risky for patients. As it turned out, it wasn't as risky as we thought it was, but at the time we didn't know that. Radiotherapy, we briefly paused it, but then we bounced back fairly quickly. We're able to offer radiotherapy reasonably quickly in wave one, but in fact, the main sort of problem or issue for people was just being scared to come in, not that they had an offer of radiotherapy. People didn't want to come to hospital then for reasons that I understand, because there was a very strong message given out: stay away from hospital, help save the NHS, don't overload the NHS. So people really took attention to that, and often people didn't want to come. There were very little relatives, no relatives, and very few visitors on wards, because we wanted to keep the amount of patients visiting people down to an absolute minimum. And that was quite challenging for me personally. If somebody goes around and sees people clinically, it's very hard to see people without their relatives there. You do a whole ward round and then spend a lot of time calling patients after that ward round to tell people what had happened. One of the big effects was patient appointments were moved wholesale, pretty much, to either move to telephone or video conferencing, and that was something that happened very quickly, and it took quite a lot of adjustment, not only for us as healthcare professionals, but for you as patients and carers. So it was all happened very quickly. It's quite tricky. That still continues, but we have moved, and we've moved a lot of our appointments back face to face where we think it's necessary to do that. So GPs obviously had to do the same. and many GP practices have kept doing some of their work virtually or by telephone, and there's a bit of variation between what GPs offer, what sort of appointments to people, and that's also taken some adjustment too for people. And it's fair to say that people lost confidence in attending the GP and also coming in to see us in hospital. One, because we told you not to, but two, people felt a bit scared, to be honest. And I can see why that would happen. So if we look longer term effects, and now I'm talking sort of mid-year 2020 to the end of 2020, we can see that most follow-up appointments were done by telephone or virtually using computers. We still continue to do that, although we have moved new patient appointments back to face-to-face where we can. Clinical nurse specialist teams and units are back geographically where they should be, largely, although some of chemotherapy units have like social distancing measures in place and reduce the numbers of patients we can see. Some of our staff are able to work from home some of the time, particularly administrative roles. And as people continue to do that, and I think that's reasonable where it's appropriate. From May to November, we were quite busy reviewing all the patients who had their treatments changed to see if that was still relevant and try and get people back started on treatment that was appropriate to them. There were still restrictions on people coming into hospital, and on our oncology and haematology ward, those restrictions still exist because those are groups of patients who are still they're still at risk of becoming unwell if they were to get COVID. So those often in oncology and haematology wards, they're areas where these restrictions still exist, and it's quite difficult for people to get their head around that, but those restrictions are still in place. There are large numbers of isolated, and many of you will have first-hand experience of this. There's large numbers of isolated people with cancer in the community. There were large numbers of people who were shielding, and also people who were looking after people who were shielding. So it became very difficult to make contact with people, and we had to put some things in place to try and address that. And there was still some fear out in the community about coming back to the GP and to the cancer centre. Yeah. So coping with waves 2 and 3, where we are at the minute, sort of November to present, still got. We had increasing numbers of cases again towards the end of the year into 2021, and actually higher numbers of cases, real confirmed cases, than we had in the first wave, and that's sort of settled down. It's still settled at reasonably high level, but it's something a level that we can cope with. We managed to continue cancer services, but often if we were to have a sudden influx of people coming in with COVID, that would again threaten our sort of services. So it's very important that people do what they can to keep the numbers of COVID admissions to hospitals down, and that means acting sensibly, wearing masks when you can, particularly if you're at risk, social distancing where you can, and obviously when you're offered vaccines, to accept them, because that's the big thing that will protect people against COVID and protect you coming in. Having had some recent personal experience of having COVID with a double vaccinator, I can tell you that it's nowhere near as bad an illness as it would be if you weren't vaccinated. It's difficult to know what's going to happen with different strains of the virus. Obviously got the Delta variant running through the UK and taken over pretty much completely now from other variants of COVID, and that's much more transmissible, but seems to be the effects of the Delta variant have been mediated by having the vaccine. So it's the very few people coming into hospital unwell, but there's still high numbers of cases. But so it hasn't moved outside of the control of the vaccines completely, but we can see that the effect of the vaccine is starting to wane. So those people who were vaccinated more than 6 months ago, the government have recently decided, as you probably saw, that we're going to be offered boosters, and those people offered boosters are going to be people who are at clinical risk, like people with cancer who are immunosuppressed, and also people like me, frontline healthcare workers, so we're going to be offered it too. So it's difficult to predict the effects of future COVID waves, and there will be waves of COVID in the future, on patient confidence, but it was definitely very marked in wave 1 and still reduced from present in waves 2 and 3. So we still see there's some reluctance of people coming in to see us in hospital, but that's not across the board. So if we can look at patients with breast cancer, for example, we can see that those people are presenting to the GPs again and saying that they want their breast lumps and symptoms looked at, whereas men with prostate cancer are less keen to come in. So their figures, their referrals are actually still not up to what they were pre-COVID. So you can see that there's a difference in groups of people, how reluctant and how keen they are to come in and see us. But our message is that we definitely need to see people if they have symptoms of cancer. So don't be afraid. The hospitals are very used now to protecting people from the effects of COVID. Lots of testings happening. So do pass on the message to people with cancer that they do need to come and see the GP and then come into hospital to have some treatment. It's a very powerful message that we need to get across. So if let's have a look at, and I know that many of you watching this will have had personal experience of this. So there's obviously, other than the physical effects of the COVID pandemic, if you actually get COVID, there's also psychological effects, and a lot of those are around uncertainty, which is already quite pronounced in people with a cancer diagnosis anyway. Your life is not the same after a cancer diagnosis than it was before. There was certainly increased isolation because there was a need to shield and look after people who were shielding, and that led to isolation. Cancer itself increases social isolation because people worry what people are going to say to them. They lose contact with friends because obviously maybe they don't even feel like going out and seeing people, and that was worsened by the pandemic. We certainly saw that there's been a reduction in normal support mechanisms. For example, harder to get GP appointments, different to get GP appointments, family, friends not visiting as often, hospital services, certainly wave 1, people were put off from coming to hospital, where people got a lot of support. So there's definitely an increased fear of illness and death, which is already pronounced in people with cancer diagnosis anyway. If you add COVID to the mix, then that puts people's anxiety levels very high, and loss of safe havens. Your home necessarily doesn't feel as safe as it did when you're in the middle of a pandemic, and the hospital certainly doesn't seem as safe. So all of that was lost to our patients. So what can you do to help yourself? Well, certainly from a psychological point of view, you can maintain social links as much as you possible, because isolation is damaging to people, and we're only just seeing some of those effects now. So if you don't feel able to make contact with people physically, you should certainly use all of those, use the telephone, make contact with us. If you really, if you, for example, worried about going indoors and meeting large groups, meet outdoors where you can in well-ventilated spaces, so you need to adapt your social life where you can. If you become distressed, then do let us know here at the hospital. Most people who are on cancer treatment have a link with a clinical nurse specialist team, or even with a doctor, or you can certainly get in touch with us and we'll try and help you. And it's important that you do share your feelings with others, because many people have the same fears in the pandemic, and there's lots of shared experience about how people might feel about this. So my take-home message is, don't isolate yourself even more than you have to, and do let people know how you're feeling. So what's going to happen next then? The short answer, I don't really know, but I can give you some. I can certainly give some clues. So there's evidence that being on chemotherapy is certainly less of a risk factor than we thought it was in the middle of wave 1. We thought that people who were on chemotherapy, their immune systems would respond very well to having COVID, and that might be a sort of fatal thing for people to have. But in terms of it doesn't seem that that's the case. There's people who have had chemotherapy and are immune suppressed to a certain degree can have COVID and recover reasonably well. So that's certainly good news. It does differ, which I'll talk about a little bit later, with people who have solid tumours like a tumour, and people who have blood cancers. There's a difference in those groups of patients, so we're beginning to realise that now. But what we can see is that vaccines certainly are less effective in people who have had chemotherapy, particularly if they've had that chemotherapy recently, and that's because their immune system and the way they respond to the vaccines is different. And what we can see is there's been a number of studies, and we can see that that the results are variable, but certainly patients who have had chemotherapy get about something like 40%, 50% of the response to the vaccines that somebody who hasn't had chemotherapy have. So my view on that is it's even more important that you get the protection that you can from vaccines rather than not have them at all, thinking it's a waste of time. And we don't really know how the boosters are going to work. It might be that they work much more effectively than the previous two in that group of patients. So it's still a really good reason to get yourself the protection that you can have. Certainly, the main challenge that we have is around capacity to run cancer services, and that's around the fact that if hospitals are, as we say, as say in the news, overrun with people with COVID, that means there's lots of admissions with COVID-19, then it'll be really difficult to run cancer services, and that's because we rely on things like diagnostic services, x-rays, CT scans. If people have big operations, we rely on intensive care, all of which are affected by COVID-19. So there's certainly been some severe challenges over the last few months, and there's likely to be more challenges as we go into another winter. So it's even why, once again, my message is it's even more important that you do what you can to keep yourself as safe as possible. And as I mentioned at the beginning of this slide, there's certainly differences in how patients with solid tumours who have had chemotherapy respond to vaccines and COVID compared to people with haematological malignancy. So by that I mean people with leukemias, lymphomas, myeloma. It's things that their immune system takes a bit longer to recover after they've had that sort of treatment, and the vaccines don't work even less well in that group, but also if they do get COVID, they're much more likely to be unwell with it than people with solid tumours. So that's something to bear in mind when you're thinking about if you've got haematological cancer, how you might look after yourself. You should be more cautious than other groups, certainly. There's no doubt that people continue to be isolated in the community, particularly those who don't have English as a first language and those who have difficulty using technology, because we're quite reliant on people using computers and telephones now. And if you're not confident to do that, then that really affects the way that you can pick care. The other thing is that as we come out of the pandemic, hopefully in the next few months, then our workforce has really been affected by the pandemic. That we're already challenged with like numbers of trained nurses and trained specialist doctors and trained radiographers, and a lot of us are getting older, myself included, and many of people are retiring, and some people, as a result of the pandemic, have taken early retirement. So it's a question of keeping our workforce up, and things that we rely on, like funding via Macmillan and Cancer Research UK, their fundraising has really been affected by the pandemic. So that's an avenue of funding that's largely been lost over the last year. Although I think that their fundraising is now recovering. Generally speaking, positive news is that every week that goes past, every day that goes past, we learn more about COVID and how to treat it, and what the best things are to do, and how vaccines work. So we're always amassing more and more knowledge. We've got 4 current vaccines approved for use in the UK, and as I wrote the slide, 82% of the UK population has already been fully vaccinated. So it's a really high level, across one of the highest levels across the whole world. So that's good work. We've got more vaccines in the pipeline. There will be more vaccines, and some of these will be adapted to the new variants, so they'll be more effective against those variants. There's boosters just recently, in the last week or so, become available to higher risk groups, e.g. people with cancer, people who've had some treatment, and we were working with the health services to work out who those people are. So if you are able to have a booster, you should hear about it and get invited to have one. There's a lot more testing available, as you know, a lot more testing freely available, really, as well as having lateral flow home testing that's fairly effective in picking up and assessing the fact if you might have COVID. Treatments, massive treatments, steps forward in terms of using steroids, using antibiotics, supporting people in ITU, and even clever targeted therapies looking at the way to treat COVID. So there's definitely advances going on. Keeping patients safe. In the hospital, certainly, we've made a big effort with staff testing. Personally, I get tested once or twice a week. We do lots of patient testing. We in cancer services here at the Royal Berkshire, we certainly even test visitors before they come in to see patients because we're so nervous about it. Obviously, the NHS app still works for us. There's lots of sort of ways of keeping people safe. The other thing to bear in mind that I'm going to take the opportunity to talk about is the way that, and the government really haven't picked up on this, is there's been a big change in what the symptoms are of COVID in the last 2 or 3 months. And that's because not only is the Delta variant a different kind of COVID than other variants, but also most people have been vaccinated, so you will get different symptoms than you used to back in the classic cough, temperature. Just those symptoms aren't in the top 5 anymore. So I'm going to show you what are the top 5, and this is sort of very recent sort of data which tells us this. So if you've been fully vaccinated, you pick up the Delta variant, the thing you will experience most likely is a runny nose. You're likely to get a headache. You're likely to get sneezing, likely to get a sore throat, and loss of smell, which is one of those classic COVID symptoms, comes in only at number 5, and only half of people get that. So what the take-home message for this is that if you start to suspect you have any of those things, and those look very much like a bad cold that you will see, or even an allergy. When I had COVID about 2 weeks ago, I thought my hay fever was starting because it felt very much like that rather than an illness per se, although it did get worse gradually. But my first feeling was that my hay fever flared up. So if you do have those symptoms, it's very easy to get tested now, and don't go wandering off and seeing lots of people and going to parties and that. It would be really good idea to get yourself tested if you have any of those symptoms. And I think that the government has been actually very poor at putting these changed symptoms out now because they should be widely available. The fact that most people, I think, having a temperature now is running at about number 8 or 9 in that list. So you're not likely to get a temperature, you're likely to have these symptoms. So bear that in mind. COVID vaccines, I'm going to talk about that. We've got 4 vaccines approved in the UK at the moment. There's Pfizer, Oxford AstraZeneca, Moderna and Janssen, which is the single-use vaccine which hasn't yet been rolled out. I think it's due to come out around Christmas time, I think. Not widely used in the UK as far as I know. All the current vaccines, that the first 3 can be given to cancer patients. We encourage very strongly our patients to get vaccinated. So if you're not vaccinated fully, then please do get vaccinated. There's little evidence to support this will do you any harm, and you're much more likely to get benefit from it than you are to get harm. Timing wise, people still ask us about this, and certainly we say that you should probably not have your vaccination the same day as you had chemotherapy, but it can be given around the same time because we're giving chemotherapy when your white count, when your immune system is at its strongest. So not the same day as treatment, but around the same time is what we say. So that's a sensible thing to do if you can arrange it. Of course, you might not be able to arrange it. I think it's more important from my point of view that you are vaccinated rather than not at all if you don't have a choice of time. So bear that in mind. So in summary, I can say that the COVID-19 pandemic is not over yet. We'll have to sort of work alongside in cancer with the endemic, as we say, long-lasting effects of COVID. Vaccination still remains our main weapon, and important that cancer patients access these, particularly the booster, call to boosters, which will be coming to probably, if you've had cancer treatment, it'll be coming to you fairly soon. The COVID pandemic will have to be managed alongside our cancer services, and we definitely won't react the same way as we did in wave 1 unless there's a massive influx of people due to COVID. We're unlikely to stop services in the same way we did again, so we can reassure you on that. The key messages about managing COVID infection are still important, as the more people who are admitted with COVID-19 infection to hospital, the less likely we are to be able to run cancer services. So that's important that you carry on being sensible and look after yourself. And we can definitely help with the psychological and social effects of the pandemic, but we have to know that you're struggling in order to do that. So you have to let people know that you're struggling in order to access help. And I think that's it for today. So yeah, I hope you've got something for the presentation today, and if you have any questions about this, you can access this via your own hospital or your clinical nurse specialist teams. Thank you very much.
Thank you very much, Mark. Really appreciate your time today. And thank you for watching. If you found this video useful, please like it and subscribe for the latest health and wellbeing sessions. Please leave your feedback in the comments. We'd love to hear your thoughts on subjects you'd like us to bring you, as well as any questions that we can answer in future sessions. To find out more about the Thames Valley Cancer Alliance, please visit our website. Details are in the description for the video. Here you can join our mailing list. We can keep you up to date on new videos and bring you details of live events that we hope will come online in the future. You can also find details of how you can get involved with the work we do here at the Alliance. Thank you again, and we look forward to bringing you more of the information you want to see.